Hello, my name is Angelica Starrett, and this is my submission for setting up a main IV line. So let's go ahead and get started. I'm going to go ahead and do my first check. The patient's name is Millie Larson. Her date of birth is 1/1/1936. Medical record number 123456. According to her MAR, so I have MAR, she has no known allergies. Today, we are going to be setting up a main IV line of 500 mils of 0.9% sodium chloride, otherwise known as normal saline, at a rate of 125 milliliters per hour with a drop factor of 10 drops per milliliter. So, and it is due now, so it's the correct time and date and situation. So I'm going to go ahead and calculate that real quick. 125 milliliters per hour, 10 drops per milliliter. Okay, so I have 20.8333, so I'm going to round that up to 21 drops per milliliter. I'm just going to do the math a couple more times. Okay, 20.83. Okay, again, 20.83, so we round that up to 21 drops per mil per minute. So I'm just going to make a note there. 21 GTT per minute. Okay, so now I'm going to go ahead and wash my hands and gather my supplies. I'm going to reposition you so you can see better. I'm hoping this works out. I probably should have hung my IV pole higher up on the wall, but I didn't, and they're kind of stuck there. So, getting my supplies. I already washed my hands. So, first, when we gather the medication of normal saline, when I pull it, I got to make sure that there's nothing wrong with it. The package is still intact. And now we're going to go ahead and do our second check just to make sure everything looks good. So again, our patient is Millie Larson. Her date of birth is 1/1/1936. MAR says no known allergies. We are giving her 500 milliliters. This is 500 milliliters, 0.9% sodium chloride, 0.9% sodium chloride. And we're going to look at the expiration date. It expires September of 2022. It is May of 2022 right now, so we are good there. The package is intact. It's not abnormally cloudy. There's nothing floating in the fluid that shouldn't be there. There's nothing in there at all. So that looks great. We are also going to get a main line. We are also going to look at the expiration date, which is 2024. It's the correct drop factor, and the package is intact. I'm going to get alcohol to wipe the patient's port before we connect it. And I'm also going to get a label so that when I hang the medication, I can label when it was started. My pen and calculator. Okay, now let's go ahead and go see the patient. Knock, knock. Hi, Millie. My name's Angel. I am your Excelsior College student nurse. Is it okay if I come in? Yes? Okay. I am going to go ahead and pull the curtain and wash my hands. Okay. Millie, before we get started, can I please get your first and last name and your date of birth? This is the patient's armband. My name is Millie Larson. My date of birth is 1/1/1936. Millie Larson, 1/1/1936. Medical record number matches. Good. Okay, Millie, let me go ahead and explain to you what we're doing today. So what I'm doing is I'm going to be setting up a your IV fluids. You already have an IV in your arm, so I'm just going to be connecting to you so that you can have some extra fluids going through you. And your doctor did order this for you. Does that sound all right? Yes? Okay, wonderful. So let me go ahead and get started. Okay, now I have my side table. So again, I'm looking, and I'm going to take this opportunity to do my third check since I have everything in front of me. So again, we have Millie Larson, 1/1/1936. We verified her name and date of birth and her ID. Millie, your MAR says you have no known allergies. Is that correct? Yes? Okay, wonderful. We are giving 500 mils of 0.9% sodium chloride, 0.9 sodium chloride, giving it to her at 125 mils per hour with a drop factor of 10 mils. So just to be extra sure, I'm going to do the math again. Yep, 20.83. So we're going to round up to 21. I would make sure to keep everything nice and aseptic. And while I'm doing this, I'm going to make sure that the line is intact, that there are no punctures to the line. All the caps are still on, so that's good. Oh, and I'm also going to go ahead and take this time to close the clamp. Okay, again, fluid looks good. We're going to make sure that we do not touch that top part. I'm going to go ahead and pull that. Put it directly in there. Again, I'm making sure that I don't touch anything. And also that I don't accidentally puncture this part. We are going to hang that. Make sure everything's unclamped except for the roller still clamped. And we're going to fill this halfway. There we go. And to keep it aseptic, I'm going to hold this end, make sure that the line is still there. Again, I'm making sure that the line is all intact. And we are going to prime the line. Make sure to get out all the bubbles. And there are no bubbles in my line. Okay, so now I'm going to go ahead and wash my hands. Put on clean gloves. And we are going to go ahead and assess the patient before connecting the line. So I have my patient's arm here, and I am going to be palpating the site to make sure that there is no redness, infiltration, swelling, heat, tenderness. Millie, are you having any pain at the IV site? No? Okay, good. So everything is good there. Sure to unclamp that. Get my alcohol. Vigorously for 5 to 10 seconds. Okay, now that is all connected. I'm going to wash my hands again. Then we are going to set it for 21 drops per minute using the roller clamp. And I'm going to be looking at the drip chamber to make and counting for a full minute, making sure that it's at the right drip rate. I go slow. Wait for the first drip. Okay. I don't know if you can see it dripping or not. No. Okay. I'm going to go ahead and count out loud. Starting, make sure it's not going too fast. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay. Just slightly. Okay. 21 drops per minute. Okay. Now, I'm going to need to reassess. So before I do that, I'm going to wash my hands one more time. Put on clean gloves. And then again, assess the site. It is not red. It's not swollen, no infiltration. Millie, are you having any discomfort here at the IV site? No? Okay, wonderful. Everything looks good there. I'm going to teach her that if there's any pain or discomfort to let us know. Washing my hands one more time. And that if for some reason the drips stop going, to call us on her call light. And then I'm going to make sure that her bed is at the lowest position, her call light is within reach, and like I said, her bed's in the lowest position and locked, and she's comfortable and safe. And any other questions for me, Millie? No? Okay, wonderful. I'm going to go wash my hands and I'm going to go chart in the MAR. Oh, and I also need to make sure that I put a label on the line for when I hung it. Thank you very much.